I think it's great to get a bit of time to talk about our, I think, friendship and also working relationship for many years already. Marcel and I know each other from, I think, 20 years back or so, from previous company we both worked at. And when you started, Marcel, with Qubiz, we were in a very early stage, so working together, especially in different industries, but also in healthcare. And I don't know if I've said it like this before, but I always really appreciate your style of work and working together as partners and making great results in the business that we're looking at, and looking at really making a difference in different sectors, and with Qubiz Healthcare in the healthcare sector as well, with our digital solutions.
Yeah, I think it was even more than 20 years, Fred, around 25. And of course, at that time, the type of projects that we were doing, more kind of outsourcing, kind of delivery of technology teams to clients. And for me, you was one of the first persons which we did more added value projects, in which consultancy to the client was needed, was required. And then the teams in the Romanian side started to learn, to understand that in the future more has to be added to a solution to a client. And that was something that we learned and we did together in those times, 25 years ago, when really doing business remote was very simple, very execution mode. And that evolved when we started Qubiz 2007, 2008. That was the moment when it was clear that Qubiz has to be in the added value area. And together we could achieve that in many clients that we served together in a joint approach. Of course, healthcare was from the beginning there, also for you as a passion, as consultant and interest, but also for us on this side, and very dear to us. Team members in Romania could really see the activities, the flow of processes in a healthcare organization, a domain which is very dear to people in Qubiz. It adds more than just serving a client, because it has also soul. It has also a purpose which is very, very dear to us. And that's why also nowadays healthcare is very, very important.
Yeah, I remember those times that we were with a team from Romania visiting actually real locations, not only talking to the employees and trying to understand what their struggle was and also what their needs were for digitizing and implementing solutions, but also actually meeting the patients, the clients on the side. Because if you understand the client of your clients, you get a really strong motivation to deliver well. And that was indeed a very good way of doing more than just, let's say, offering technical solutions, but really solutions that fit the real needs of the business, which over the years I think we elaborated more in not only going to other clients, but also learning how to approach that. Because what we see a lot in the Netherlands, in the healthcare sector, is there's a tremendous shortage of personnel that can actually do the real work with the patients on a daily basis. And there again is a lot of administrative burden. There's a lot of people that feel like almost a quarter of their time they're sitting behind computers and typing in and doing all the red tape and all the paperwork that is needed. But actually why they chose for the healthcare was because the passion for the patients, for the clients that they wanted to help. And so that's what we learned over the years, was how important it is to really understand what in the process can simplify with automation, with digital solutions. And I think that's something I think is really dear to my heart. Not only the healthcare side, but also just what opportunities new technology brings in order to reduce such administrative load and really help them to focus on the quality of care the employees instead of trying to get rid of all the administration that they need to work on.
Absolutely, and this approach is accelerating nowadays with AI, ML, LLM, automation, chatbots. So more and more added things, innovation around the solutions to clients.
Yeah, maybe a nice example of this is what we're working on with a client is related to building with AI a care plan. Because if you want to deliver care well, you need to understand what are the goals that the client has. It's not that you as a care provider says, okay, this and this is what you need, but it's what we call shared decision making. So the patient, the client needs to be involved in understanding what's the type of care and what's the decision he can influence. And what we see with AI is that you can really help employees be inspired by not using the traditional ways of approaching care, but really making it a blended care, making it something that the patient and the personnel together, the care workers, can work on and get good results on. And AI can have a tremendous benefit there because the cognitive load of people is so high that a lot of things people cannot remember and do well immediately if they're not be helped by a chatbot they can ask questions on, or an AI assistant that will help them really get the right care plans in place. And next to that, another example, a great example I think, is what you see nowadays in many places is the speech recognition. So the recording that the employees need to do when they have met a client is a lot of work. And why let them type it all in the computer if just during the meeting we can make that audio recording of the meeting, of course with consent of the client, and then just have the full automated process be recorded in the system as a result of that recording that was taking place. And that is a tremendous help to care workers, we find.
Yeah, and that's something we have in our standard offering to a healthcare client, absolutely. Adding to this, Fred, I think an important thing that we always had and we will continue to have is the co-creation model, in which actually the solutions we develop to clients are not only driven by us or us by the client, but are done in a co-creation model, in a discussion in which actually we share ideas, we brainstorm about needs and challenges which they have, and then by a joint effort solutions are coming. That's something we did also in the past, but by why we called in the past, let's say, the Qubiz co-creation model. And that's something we want to repeat and invite as many healthcare organizations they want to join and really work together at solutions we can have by improved IT delivery.
Mm-hmm. Yeah, and it's nice now that we have this location in Utrecht where we have the gym, the Jarbus Innovation Mile, where there are a lot of facilities to organize these co-creation events. Because if you want to really understand how to help the care workers, you need to understand where they're at. And there's processes like design thinking, which is very well known, I think, that help you to emphasize on what are the actual needs of the care workers or even the patients, and come with solutions that are carried by them. Because if they feel it's a solution that they co-invented with us, also they adapt it much easier. As you see, a lot of projects that fail in IT is because there is not a close relation with the end users. And that's what we believe is essential. And therefore, co-creation really helps to understand where they're at and how we can introduce something that is also going to be accepted if it's when it's implemented with these organizations. And a lot of facilities can help there, like the co-creation setups at the gym, but also just workshops that we do with clients on site, visits on client site, and actually talking also to the management to understand, okay, in terms of business intelligence, in terms of management information. What do you need to help your employees to do the best they can in the healthcare? And that's why indeed co-creation is one thing we really strive for.
Yeah. So in Direct, we invite anybody which is interested in the Qubiz Connect healthcare events that we will organize in the future, to brainstorm, to discuss challenges, and to find together solutions where we can contribute.
Yeah, indeed. And what I believe also is it's a lot about partnership. So it's not just about, let's say, one provider and one care organization finding each other, but it's really about a network, sometimes regional, sometimes country-wise, a network of organizations that are together working on it. If you look, for instance, in the Dutch healthcare sector, there's a lot of questions. How do we do interoperability? Because in the Dutch healthcare sector, we don't have one central system everyone is using. No, it's a lot of fragmented applications that not always work together well. So if we help to introduce a better way to interoperate with those systems, we actually can reduce the administrative load. Because people don't have to enter the same client information, questionnaires, whatever, in 2, 3, 4 systems, but they're integrated. And this way, we really help the Dutch landscape of healthcare providers, together with our partners in this. Yeah, with Qubiz Healthcare, I really believe that we need to focus on what's currently happening in the Dutch market. In the Dutch healthcare market, we see, like I said, the really administrative burden. We see a lot of growing aging population that need more help, and that is in different sectors. That is in disability care, that's in mental care, that is in home care or nursing care. And as Qubiz Healthcare, we really believe that we should innovate with those organizations to deliver digital solutions that help reduce the administrative burden for them. And in order to do that well, we don't believe you just go into an organization and you find those innovations. No, we have a framework for it. We have a framework called the CARV framework. That's the Continuous Automated Reduction Framework that helps organizations to understand where are your highest need of administration and how can you reduce them in an organized manner. And not only to introduce technology, but actually also implement the technology and train the users and make them understand how to use it well, so that in the end we can really help the organization to be more productive and to be more client-oriented and patient-oriented in what they do.
One add-on in these initiatives, it's actually also the Qubiz Incubator, which is our side vehicle, sides to services to healthcare providers, by which we invest technology in startups which really have a good business idea in healthcare, are really adding value on the market, and that's something we do already for 8 years. And a good part of the portfolio we have there is in healthcare, and that includes also some startups which are investing in, let's say, process automation and improvement in processes in healthcare organizations, also elderly care. So definitely that's another vehicle by which we can support, let's say, the industry, the domain.
Yeah, I see that also, because I see a lot of organizations having innovative ideas and they want to really excel that, but they need some party to really help them at one side with technology, but maybe also buy technology with an investment in what they want to grow in. And especially when we're meeting many different organizations in the events we are participating in, but also the QConnect events that we're organizing, we can link up with those parties that are looking for tech investors in their organization, where we are really looking for strong owners of a good idea that is helping them to really grow it from, let's say, a basic stage where they might have one client, to really scale up and make an organization that really comes well across in the healthcare market. So that's indeed a good addition, Marcel, the possibility with the incubator to do that. Yeah.
I remember 10 years ago when we had the first Qubiz Connect Healthcare event. That was also the start for our Qubiz incubator. And I remember even now, Fred, that by this brainstorming which were done then by people which came, we actually supported some nice startups which had some good ideas in healthcare. That was the start about 10 years ago for both the Connect events and the incubator. And since then, we are actually supporting more and more in that. And happy to see that in the incubator, the portfolio has a large portion of healthcare startups and solutions, both the Netherlands and the BTUK.